Thank you, Madam Chairman. I think on this subject, and I've really enjoyed the conversation with the panelists and what they've contributed. But on this one subject, I think we can all agree that in our classrooms, our children all across America are suffering from this combination of mental health and substance abuse. So I'm not expecting answers from everyone on the panel, but I would hope that they would get back to our offices if they would. But I want to direct some of my questions primarily to Secretary McGants. And let me just start with saying that teachers across, they're trained and they're certified to teach. But we're asking them to also get involved in counseling, nutrition, and identifying autism. This distracts from their trying to teach. So my question would be, would we be beneficial to encouraging mental health counselors in each of our schools across America? Could you address that subject briefly?
Yes, thank you, Representative McKinley, and it's nice to talk to you again. It's very important that we put resources in our schools. We have a history of doing that. Teachers, I agree with you, are being asked to do far too much. In our administration, we were so concerned about the needs for mental health services and substance use disorder services for students that SAMHSA and CMS actually put out a guidance to states and to communities and to school districts about how they could think about putting mental health services in place and pay for it, get it paid for.
Thank you. Thank you. I've got several other quick questions to follow back up with you on this as well. But the other is classroom size. Our teachers are often confronted with 25, 30 children in the classroom. So is there any evidence to suggest that smaller classroom sizes allows our education community to be able to identify these problems better and do a better job for our children by having small? Is there any written evidence or white papers we could study about that?
So this is not my area of expertise, but I believe that's the case because I believe that classroom sizes, they've worked to reduce classroom sizes for many years. Yeah.
Okay. Now the other is once in a school, once we identify these children that have problems for a variety of reasons, in rural America, we don't have the resources. This isn't New York or Seattle or St. Louis. In West Virginia, our largest town in my district is 30,000 people. So how do we provide these services? Once we identify someone with autism or someone with a mental health problem or someone with opioid addiction, how are we supposed to deal with that in rural America? What would your suggestion be?
So SAMHSA has a program called Project Aware. Project Aware provides resources to schools in many parts of the country. That program now allows behavioral health aides to be in the classroom. And that's an important piece of providing some mentoring and some support to students who are identified as having those kinds of needs. I think those kinds of programs should be expanded. One of the things that I heard during my time of traveling around to schools was that there just were not enough counselors and social workers to assist all of the children who need those services. So we need to train more of these kinds of professionals, and we need to put mechanisms in place to pay for those people to be in schools and provide those services on site.
Thank you. Thank you. Now, my last question for all of you what are some examples of real productive modified that have been tested in our school systems all across America that are working to address behavioral health problems, opioid addiction, nutrition problems, on and on? Are there some models that we've seen work very effectively that we could be promoting throughout this country? Any one of you could get back to us. I'd like to, you could follow back up with our office, or if you'd like to add something quickly here in the few seconds I have left.
Mr. McKinley, maybe we can ask the witnesses to provide that written to the committee, because I think we'd all like to see that.
Thank you very much, Madam Chairman. I think it would be very helpful. Thank you. I yield back.
Thank you so much.